Hi, my name is Jasmine. I'm a nursing student at JCTC, and today I'm going to go over spinal blocks for exam 3. This is very helpful to me. I hope it's helpful to you, and I hope you like my video and hope you learn something. Um, so a spinal block is an infusion of opioids and painkillers that is inserted into your dura mater subarachnoid layer. It's further than your epidural space. Um, the use is usually used during C-section. Excuse me, but can be used during second stage of labor, although it's very rare. Um, the action is a painkiller. Okay, it relieves pain. Um, and it's local, and it's one injection. Um, and the advantages is that I'm gonna write them down. The advantages of this is that it is a quick onset. Unlike if you're a compare and contrast type of nursing student, spinal blocks are quicker than epidurals. This is quicker. Epidurals are slow onset and infusion. These are local, quick. Spinal blocks are straight to the point. Um, Another advantage of a spinal block is the administration. It's easy. And the last advantage of a spinal block is that you have a decrease of the need of medication. Now, like every great thing, spinal blocks have their disadvantages, okay? On the mom's front, okay, it causes hypotension just like epidurals do, okay? On the fetal aspect, it can cause alterations, heart rate alterations, slash hypoxia, okay? Another disadvantage to this with the mom too, I forgot to add, is just like epidurals, it causes posterior puncture headaches. So you get those really severe headaches, posterior puncture headaches. And with this, the same interventions apply. You're going to get caffeine, painkiller, or a blood patch. Same stuff. With the baby, you're going to make sure with our nursing assessments, which I'll get into later, you're going to be monitoring this fetal baseline. Not just the fetal baseline, but the mother's baseline too. Okay. Contraindications. All the contraindications for epidurals are close to the same as someone with a spinal block. Okay. If they have any type of CNS disease, uh, increased intracranial pressure, spinal injury, spinal bifida, no spinal block. If you have hypovolemic shock, no spinal block. If you have missing some, oh, I already said hypovolemic shock. Lord have mercy. If you have an allergy, you're not going to get this. If you have an infection at the site, you're not going to get it. If you say no, uh, and last but certainly not least, and should have been number one, is a blood coagulation disorder with spinal block. So both epidurals, if you watch my epidural video, spinal blocks too cause contraindicated in CNS problems, spinal injury, spinal disease, spinal bifida, hypovolemia, hypovolemic shock, excuse me, really bad hypotension. If you have a blood coagulation disorder, if you already have an increased intracranial pressure disorder, if you have an infection at the site, and if you say no, or if you have an allergy. Those are the contraindications for giving someone a spinal block. Now let's talk about nursing care. Nursing care, when we're giving someone a, I can erase this because I didn't write it down. I'll just talk through it. Where's my eraser? Okay, so nursing care for someone with a spinal block, you want to make sure consent and information is given. Right, because this is like the most important thing. It's important for us to know like side effects and stuff like that, but the nursing interventions or nursing care is like the most important. This is the heart, the bread and butter of our jobs. Okay, so we're gonna make sure we have an 18 gauge IV. Okay, bolus. I think the same, right? Bolus. Yes. 500 to 1,000. Similar with epidurals. Okay. And then we're going to establish a baseline. We need a baseline for both mom and fetus. Okay. Next, we're going to do, we're going to assess pain level. If she's in pain, is it working? Another thing we're going to do, posturing, positioning, posture, and safety, because this also can cause bladder issues. So we're going to make sure, like we did with the Foley catheter, make sure she has a catheter in, like we did with the epidural. Make sure she has some type of catheter in. Okay. Now, let's talk about combination epidurals and spinal CSE. Those best of both worlds. Okay. So, the CSE is great. Okay. We'll talk about this together. Okay. So, a combination epidural, well, SE, excuse me, SE is great. You have best of both worlds. And guess what? You can walk. So you don't have movement restriction like you do for epidural. Okay? Ambulation. I can't spell today. That is one of the best things about a CSE. Another one is that this is not only quick like spinal blocks, but what else do we love about epidurals? It is continuous. So you really got best of both worlds. Okay? Beautiful. Now, whatever beautiful thing is a bad thing. Okay? Now, the bad thing with CSEs is that you have puritis. Hope I'm saying that right. May not be, but my friends know I pronounce things wrong. Puritis, but when I see it, I know it. It causes itching, like you're just itching, and it's severe. Okay? It's really bad. And both of them cause urinary retention if you use them together. So that's one of the things with CSE. It's great, best of both worlds. You can walk around. How did I put quiet there? So I'm tired. I meant quick. Okay, quick and continuous, but it causes severe itching. I'm so sleepy. Severe itching and urinary retention. Okay. And did I miss anything? We can go over this again. Okay, since we're talking about CSEs, so similarities, problems with both of these is that spinal blocks and epidurals cause what's known to the world as maternal hypotension. Okay. So what we want to do as the nurse, we have to do our ABCs: airway, breathing, circulation. Airway. She should be breathing. We know that this stuff causes respiratory depression. Okay. But let's say she's not breathing. Her airway's great, but she's not breathing. What we're going to do to increase her breathing, we're going to give her O2. After we've done that, we're going to increase her IV flow rate, okay? That's with circulation. Another thing we could do to increase circulation is wedge. Wedge on her hip, okay? Now, wedge but most definitely, we can do wedge. But let's say there's already one on there. Who knows? Oh, we have to turn her to her left side. Let's put left side, left lateral side. Better terminology. Okay? Because this prevents pressure on the vena cava or back up on the lower on the vena cava, and it prevents the baby for cutting off. So when you cut a section of the artery, it looks like this, right? And if blood's good, you got your little red blood cells just flowing freely. But if the baby's on it, it looks like this. And you got your red blood cells are having a hard time getting through. So if you turn it to a left lateral side, it's way easier for blood flow to increase oxygen. Now, if all else fails, we're going to give her a drug that's called ephedrine. This drug increases BP, and the dosage amount for this drug is 5 to 10 milligrams. Okay, get it? Got it? Good. Okay, review. Combination spinal epidural, best of both worlds. She can walk. That's great. You have the best of both worlds in regards to the spinal block. It's quick. In regards to the epidural, it is continuous. However, the bad things that happen is maternal hypertension, itchiness, and yes, maternal hypertension, itchiness. Uh, when spinal blocks and epidurals both cause maternal hypertension. So we're going to use our ABCs to combat this. We're going to look at her airway. Airway's fine. Hopefully it's not an airway problem. Um, and then we're going to go to B, breathing. Is she having trouble breathing? Is her respiration rate less than 12? Okay, that's when we call the doctor. But if it's less than 12, we notice it and it's a slowly decline, we have to give her O2. Okay, if she has a circulation problem, but hypertension, you do. And you give her increase the IV flow rate, and you're going to turn to her side, left lateral side, and that relieves pressure. Okay, on your abdominal aorta. And if all else fails, then we shall give her ephedrine, which increases the blood pressure and is 5 to 10 milligrams. Okay? Bye, guys.